Hey pet parents! Today we're tackling a topic that every responsible pet owner needs to know about: pet first aid. We all hope our furry friends stay happy and healthy forever, but accidents can happen. Knowing basic first aid can make all the difference in an emergency, potentially even saving your pet's life before you can even get them to the vet. First things first, let's talk about what should be in your pet first aid kit. Think of it like a human first aid kit, but with a few pet-specific additions. You'll want gauze pads and roll adhesive tape, antiseptic wipes, make sure they're pet safe, no alcohol or hydrogen peroxide, blunt tip scissors, tweezers, and an elastic bandage, but also include additional rectal thermometer specifically for pets, and a small bottle of hydrogen peroxide only to be used under veterinary guidance for inducing vomiting, never without consulting your vet first. And don't forget your vet's emergency number, the first number for an after-hours animal hospital, and even the ASPCA Animal Poison Control Center number, all stored clearly in your phone and on a card in your kit. Now let's go over a few common emergencies and what you can do. Remember, these are first aid steps to stabilize your pet, not replace professional veterinary care. Always get to a vet as soon as possible. Scenario 1. Minor cuts or scrapes. If your pet has a small cut, first gently clean the wound with pet-safe antiseptic wipes. Then you can apply direct pressure with clean gauze pad to stop any bleeding. Once the bleeding has stopped, you can lightly bandage it to keep it clean. Scenario 2. Choking. This can be terrifying. If your pet is choking, they might be pawing at their mouth, coughing violently, or struggling to breathe. First, if you can safely do so, open their mouth and look for an object you can easily remove with tweezers. Be extremely careful not to push the object further down their throat. If you can't see or reach anything, you might need to perform a modified Heimlich maneuver. For small dogs, you can hold them upside down and gently shake them. For larger dogs, you'll want to place your arms around their abdomen just behind the ribs and give a quick upward thrust, similar to a human Heimlich. But again, this is a last resort and should only be done if your pet is truly choking and you can't get to a vet immediately. It's always best to get immediate veterinary help. Scenario 3. Heat stroke. Especially in hot climates like ours, heat stroke is a serious danger. Signs include excessive panting, drooling, lethargy, vomiting, and even collapse. If you suspect heat stroke, immediately move your pet to a cooler area. You can apply cool, not cold water to their paws, ears, and groin area. You can also use a fan. Do not use ice-cold water, as it can cause them to go into shock. Get them to a vet right away, even if they seem to recover, as internal damage can occur. Scenario 4. Poisoning. If you suspect your dog has ingested something toxic, like certain human foods, plants, or household chemicals, the first thing you need to do is call your veterinarian or the Pet Poison Control Center immediately. They can tell you if it's safe to induce vomiting or if other steps are necessary. Never try to make your pet vomit without professional guidance. Time is critical in poisoning cases, so act fast. Learning pet first aid isn't about becoming a veterinarian overnight. It's about being prepared, knowing how to react calmly, and providing immediate comfort and care to your beloved pet until professional help is available. Having a well-stocked first aid kit and basic understanding of these techniques can make all the difference. I encourage all of you to put together your own pet first aid kit today, and even consider taking a pet first aid course in your local community. Your pet's well-being is worth it. Thanks for watching, and remember, a prepared pet parent is a pet's best friend. See you next time.